Hi guys, welcome to Pathopulse_Radhika and series on tumors of female genital tract. So the tumor for today's discussion is going to be choriocarcinoma. So basically I'm going to discuss about the ovarian tumors. In ovary you can get choriocarcinoma, though it's rare. So choriocarcinomas are common following pregnancies, right? Maybe not a term pregnancy, it can occur following a term pregnancy or sometimes following a vesicular mole. It can occur in the uterine cavity, right? So those choriocarcinomas we call it as gestational choriocarcinomas. So remember, they are different from what I'm going to talk today, which is a ovarian tumor. Choriocarcinoma, apart from occurring following any pregnancy, it can occur as a tumor per se in the ovary, though they are rare. So from where do they originate in the ovary? In the ovary you have germ cells. So from those germ cells they undergo extraembryonic differentiation and you can get a choriocarcinoma in the ovary, right? Whereas the gestational choriocarcinoma arises from your placental tissue. It arises from the placental tissue. There are certain differences between the choriocarcinomas which arise in the placental tissue, which we call it as a gestational choriocarcinoma, and the tumor which originates from the germ cells in the ovary, the non-gestational choriocarcinomas. Both are quite different. Okay, so as I told, choriocarcinomas which arises from the germ cell, it's a germ cell tumor of the ovary, is rare in its pure form, but it can occur as a part together with other germ cell tumors like yolk sac tumor, your dysgerminoma, and other germ cell tumors. So what I want you to be clear at this point is you have different choriocarcinomas. One is a gestational choriocarcinoma which occurs following pregnancy, and the other one is a germ cell tumor which arises from the ovary. So apart from ovary, they can arise in the mediastinum as well. So you should know the difference between both. Of course, I'll be telling the differences, few more differences later. Okay, so the histology is going to be the same, but what's the difference between your gestational choriocarcinoma and those which are going to arise as a part of your germ cell tumor in the ovary? So this occurs following pregnancy. So you have the paternally derived genetic material, that we call it as a paternally derived DNA, that will be present in case of gestational choriocarcinomas, whereas that will not be present in the case of germ cell tumors which arise in the ovary, right? Like all of you must have known about this drug called methotrexate. So they usually give it for choriocarcinomas. So these gestational choriocarcinomas, they respond to chemotherapy, whereas the germ cell tumors, the choriocarcinomas which arise in the ovary from the germ cell, they are usually unresponsive to choriocarcinoma. They are unresponsive to chemotherapy, right? This must be very clear. These are the differences. So gestational choriocarcinoma is a separate entity, so we'll discuss in some other video. So choriocarcinoma which occurs as a part of germ cell tumor, they can arise in the ovary or in the mediastinum. They don't have paternally derived DNA and they are unresponsive to chemotherapy. And histologically, it's going to be the similar one. So choriocarcinoma generally on gross appearance will have a lot of hemorrhage and lot of necrosis. Okay, they'll have a lot of hemorrhage and necrosis, and this is all hemorrhagic part which you are seeing, these pink ones. Whereas here you see certain cells, they are basically a proliferation of cytotrophoblast and syncytiotrophoblasts. One thing which you should remember, it's very important, is you usually don't see villi in choriocarcinoma. If at all you see a villi, a placental villi or any other villus structure, even in a gestational choriocarcinoma, it's usually against the diagnosis of choriocarcinoma, right? So that point you must remember. In case of gestational choriocarcinoma, you should never see a villi, right? So, or else the histology is going to be the same. You have a neoplastic proliferation of cytotrophoblasts, syncytial trophoblasts, and intermediate trophoblasts. Syncytial trophoblasts are giant cells, so that's what you're seeing here. The rest are all proliferation of other trophoblasts, right? And you have a lot of hemorrhage. So this is how a choriocarcinoma looks like. So any hemorrhagic tumor, extensively hemorrhagic tumor, look carefully for choriocarcinoma. And one important thing is you can have elevated levels of beta HCG. This is very, very important. So you can follow up the patient by estimating the blood levels of beta HCG. So to summarize about choriocarcinoma, so choriocarcinoma is a germ cell tumor which can arise from the germ cells in the ovary. Gestational choriocarcinoma is a different entity. Okay, and the histology is going to be the same. The difference is the choriocarcinoma, which arises as a part of germ cell tumor along with other tumors. They are unresponsive to chemotherapy and they are very aggressive, and they usually, by the time they are diagnosed, they have already metastasized to some other parts of your body like your lungs, and they don't have paternally derived DNA. Beta HCG can be used for follow-up. Okay, so this is about choriocarcinoma. Thank you.